when you get that kind of request.
Republican Congressman Phil Roe joins us live. He is also a doctor. Congressman, I know that you are opposed to this legislation. What is your problem with it? What don't you like about it?
Well, I think, Greta, you had Dr. Price on just before, and I think one of the things that I bring to the table is I'm the only physician, only really person that's had to deal with a plan that's similar to, has many aspects of the plan that they potentially will pass tonight, TennCare. And what we did in the state, and you and I have talked about this previously, but what we did was we had a managed care plan that competed for your business. It was first dollar coverage. It sounded really good. What happened in 10 years in our state was we tripled the cost of that plan. And the other thing that was is disturbing to me about the plan is that we're 17 years into this now. And in this year, for the first time, we're actually rationing care. If you're a patient who has our Medicaid plan, which is known as TennCare, you're going to be allowed 8 patient visits, 8 doctor visits for the entire year. And the state will pay a hospital, no matter what your bill is, $10,000 total. The providers, the doctors, and nurse practitioners that see patients for this plan are going to be paid about 50 cents on the dollar, about half of what it costs them to actually see the patient. So we're expanding Medicaid in this plan by up to 15 million people. And we've also found in Tennessee what happened was, and this will happen in this plan the president's going to pass, or the legislature, the House is going to pass tonight, is that 45% of the people who got on TennCare had private health insurance and dropped it and got on the public plan. And you'll see businesses do that around this country. And the thing that worries me, Greta, the big chunk that we're taking, worries me more than anything, is the big chunk that's coming out of Medicare. If you take $500 billion out of Medicare, and in the next 10 years, we're going to add 35 million baby boomers to Medicare. In that, you know that 3 things are going to happen. One is you're going to decrease access for patients because there are going to be so many of them trying to get into the same doctor. Number 2, you're going to decrease quality if you can't get into your doctor. And 3, you're going to increase costs for our seniors.
Congressman, to what extent the system in Tennessee, as you've just outlined, does it mirror the new federal statute? Is it 95% like it or 50%? So I'm trying to figure out how much I should assign to what you just said in terms of what could happen here.
Right. Well, if you look at it, half of the new enrollees are going to be Medicaid patients, so it's half. And the other part, with the pre-existing conditions and the no deniability of insurance, is exactly what Massachusetts is trying to do now. And listen, my hat's off to Tennessee and to Massachusetts for trying to do this, but this is a failed system. It didn't work, and it ultimately ends up, if you budget so many dollars for health care, what will happen is you'll end up rationing care. And one of the things that we thought we were going to do in Tennessee was increase quality and access. What happened was, what did we get for all this money we spent? We were 50th out of 50 states for prescription drug use. We had the most of any state in the union, and we were 47th in health outcomes. What's occurring in Massachusetts now is they can't afford the care.
All right, Congressman, when I was walking over to the House today, I ran into you outside the U.S. Capitol. You were going to the United States Senate. What were you doing over at the U.S. Senate? Was that planning? What did you learn? Can you give us some sort of behind the scenes?
Oh, sure, I surely can. We were going for a conference. It was a very short conference in the Mike Mansfield room. And it was basically just to sort of get us prepared for what was going on today, what the schedule was going to be like, and just some speeches from leadership. So it wasn't really a big deal.
All right, Congressman, thank you.
Thanks,
Next,
Greta.
our special On the Record continues. We are live in the heart of the action, and if you